Chula Radio Plus presents Chula Innovations Unlocked.
Sawadee Welcome to Chula Innovations Unlocked. I am Suphajon Klinsuwan, and today I'll be taking you to talk to a world-renowned hair loss expert at the Dermatology Department, Chulalongkorn Memorial Hospital in Bangkok. Associate Professor Dr. Ratchathorn Panchaprateep is head of the Hair and Scalp Center, Chulalongkorn Memorial Hospital, Thai Red Cross Society. She discovered that low-level laser treatment, or LLLT, can stimulate hair follicles and hair growth, which can deliver results in 24 weeks. Her research on proteomic analysis in derma papilla in male androgenetic alopecia after treatment with low-level laser therapy, which confirms the efficacy of low-level laser therapy for genetic hair loss, made Dr. Ratchathorn Panchaprateep become the first Thai female doctor to win the highest Platinum Follicle Award 2019 from the International Society of Hair Restoration Surgery, or ISHRS. Dr. Ratchathorn, thank you so much for your time. My first question would be, what in the first place inspired you to develop the low-level laser therapy in curing hair loss?
Actually, the low-level laser therapy has been used for the treatment of many facial abnormality. For example, we use a lot of laser to rejuvenation the face, like for the wrinkles, acne, scar.
Right.
But actually, the laser can also help to stimulate the hair also.
Right.
Because the hair cell is also alike or similar to our skin or fibroblasts in the skin.
Right.
So that's why I think that one machine can do everything. So in our department, dermatology department, we have a lot of laser that has been using for the treatment of facial treatment before. So I adapted to use for the hair.
Now, what are the causes of hair loss, and how does the low-level laser therapy solve this issue?
Our study is using the low-level laser therapy for the treatment of androgenetic alopecia.
Right.
For the androgenetic alopecia, actually, it's the most common hair loss in our world. It's usually affected men and also the women.
So in simple English, it's genetics.
Yes, it's a genetic hair loss. It is usually caused from the genetics, including with their hormone. For the male, it's because of the male hormone that we call the androgen hormones.
Right.
It's affected to the hair follicles that make the hair follicles become smaller in size.
Right.
So in these particular patients, you can observe the clinical that the patients, when he was teenager, he has a full head of hair.
Yeah.
When you get older, you start to have receding of hair in the front, right?
Right. The hairline starts to go back a bit.
Yes, just receding. And after that, some people have thinning on the crown. And some people in the at the late stage, they become totally bald, like a U shape on the scalp.
Right.
For the woman, it's also have androgenetic alopecia also. But the woman, the thinning usually in the center on the mid part of the hair follicles.
I see.
So in this type of patient, so we see the patient first and let's start the treatment as early as possible.
Associate Professor Dr. Ratchathorn says that, statistically speaking, up to 40% of Thai people have thinning hair, hair loss, or baldness problems. The main causes of hair and scalp problems are 1. Genetics, outstanding genes from the father or mother with thinning hair or scalp problems. 2. Testosterone. During puberty, testosterone, or the male hormone, will stick to the hair follicles, causing follicles and hair to become thinner and fall off easily. And 3. Environmental factors such as stress, sunlight, malnutrition, vitamin deficiency, and more. The head of the Hair and Scalp Center, Chulalongkorn Memorial Hospital, reveals hereditary hair loss is the top cause and is increasingly found in younger people. As a doctor, do you see hair loss or baldness as a sickness that needs to be cured?
Yes, actually the patients is not only affect the physical look.
Right, so it's not only the appearance.
Yes, actually they affect there's the psychological problem. So of course it affect everyone. They usually, because if you have, I think it's about your self-esteem. And women actually have more problem than men. Sometimes I think women also concerned on this problem.
Some people may ask if the thinning of hair and hair loss is a really big thing. Well, consider it this way. Humans have long been obsessed with grooming and taking care of our hair. Like how the ancient Egyptians used castor and almond oil to moisturize and protect their hair amidst the hot and arid climate, also believing the mixture promoted hair growth. And just recently, Fortune Business Insight reveals that the global hair care market is projected to grow to $112.97 billion in 2028. And despite not having the exact figure on how much money people, especially men around the world, spend per year to maintain, regrow, transplant the hair on their scalps, the Financial Times claims the annual expenditure on this matter is over $2 billion worldwide and outstrips the spending of malaria control. Regardless of the global demand, today there are currently only 2 FDA-approved medical treatments for hair loss. 1. Taking finasteride medication to stop testosterone from sticking to the hair follicles and to slow down hair loss. And 2. Applying minoxidil topically and continuously to the scalp to plump up and thicken the hair. And the third popular treatment is transplanting the hair from the denser area.
Usually the treatment for the androgenetic alopecia, the FDA-approved treatment is a medical treatment.
Right.
The medical treatments, there are 2 types of medical treatment. The one is called the finasteride group. This one is inhibit the male hormone to attach to the hair root. This is usually common in treatment for the male. And we have another treatment, we have another medication that called minoxidil. This one is usually help to stimulate the hair from smaller size to become a bigger one. And this is FDA
the
approved.
thickness of the hair.
Thickness,
I
yes.
see.
And this is FDA approved for the treatment of both male and female.
I see.
So only 2 medications that FDA approved for the treatment of HA right now. So they are also limited. So that's why we are a wide range of doctor or physicians seeking for the new treatment for the androgenetic alopecia.
I see.
So after that, I come to the laser treatment. So for the laser treatment, we can use, there are 2 types of laser treatment that we develop. The first one that is like a home use device. This one was the first study that's quite like 5-6 years ago. I did a study on the using of low-level laser treatment as a comb or like a cap. And then the laser treatment, you can wear a cap at home as a home use device every other days or three days a week. And then it's gradually improve the hair. That is the first study of mine. That is quite 6 years ago.
Right.
Study of that type of laser. But right now, a couple years ago, we started with a new one that using the laser at the hospital. So this one is particular go deeper than the one that is the home use device.
Right.
But of course, you have to come to the hospital for the treatment.
I see.
So the laser can be applied on the scalp. We recommend to do every 2 to 3 weeks for totally 5 to 10 sessions.
Right.
So to get the big improvement.
Right. And are we going to see like 100% full recovery or
No,
how?
no, of course not. The laser usually stimulate. It's usually only for the patients who has early or middle severity of the hair loss.
I see.
It's not for the totally bald patient because the mechanism of action of the laser just help to stimulate the existing hair to become stronger or healthier.
I see.
So that means the patient need to have a lot of hair, enough hair on the scalp.
To begin with.
Yes. So it is good for the patient who have early to middle stage of the hair loss.
I see.
But the patient who have totally bald or very severe, hair transplantation is their choice.
I see. So how sustainable is this process once it's finished?
Actually, for the androgenetic alopecia, it's not a cure disease. Yes, because it's from your genetic. You get all the problems in your genes. So the treatment should be continued. For example, like when you get better after 10 sessions, many patients need a maintenance phase.
Right.
For the maintenance, of course, you need to do like quite a long time.
Can you compare the pros and cons between the low-level laser therapy, your process, with the other types of treatment or cures that's available in today's market?
When you compare to FDA-approved treatment, it's a medication treatment. Actually, it is difficult to compare because the laser is I usually use as an adjunctive treatment. The standard treatment or FDA approved treatment the patient needs to use. For example, the patient come with the early stage of their hair loss. I usually give the patient the medical first.
Oh, okay.
Yeah, the medical treatment is FDA approved treatment. You give first. But if you want something that add on for the medical treatment, I usually combine with the laser. The good thing of the laser is the safety, because the laser is like outside is quite safe. Only some side effect like itchiness or dryness after the laser is usually very short time and very mild.
Right, because there's no chemical residue remaining in the body.
Yes, to just apply some moisturizer or some oil to help about the dryness, it usually help better. So it's quite safe and it's effective in the particular patients that we select that is matched with the laser.
And did you know that certain medical drugs can cause hair loss as a side effect? Many of them are drugs used to treat cancer, arthritis, depression, heart problems, and high blood pressure. On the contrary, many believe that frequent hat wearing causes hair loss because it suffocates the scalp. This is a myth. Hair follicles actually get oxygen from the bloodstream, so wearing hats has no effect on hair loss. Frequent shampooing leads to hair loss? Not necessarily true. When people notice their hair thinning, they pay more attention to hair that falls out after shampooing and assuming this is the cause. Well, if you're losing less than 70 strands of hair daily, you're still considered safe. But according to Associate Professor Dr. Rajthon, whenever more than 70 to 100 strands of hair fall off each day, that's a sign of abnormal hair loss. This needs immediate attention and consultation with dermatologists. Now, you were recognized and awarded by the International Society of Hair Restoration Surgery. Congratulations on that, first of all.
Thank you.
Right. So what was the international reaction towards your finding?
Actually, the International Society of Hair Restoration Surgery is an organization that gathering a lot of hair experts, especially in the hair transplantation field, together all over the world. So it is good because I'm the second type person who received this award, and not only a lot of Asian doctors received this award, and I think I am the youngest one that received this award at my age at that time.
Right.
So of course I'm glad that they recognize what I have done in the past. Either study is a contribute for the lecture, is a contribute in terms of education to all everyone.
Right.
I am also now the director of the ISSRS, so I received the fellowship training from the doctor from all over the world. So I think I feel proud to have that, and I think it's pushing me to do something that better, to get a better or higher award on that.
Right. Speaking of doing better, what's the next research and development process of the low-level laser therapy?
Actually, right now I don't have a research on low-level laser therapy, but we are a little bit shift to the new disease that we call the frontal fibrosing alopecia. It's some type of scarring alopecia. For the androgenetic alopecia, of course, it's the most common one. But right now, we have a lot of patients in our hospital. We call the frontal fibrosing alopecia. The patient have a receding of the hair at the front in female. And this is become the scarring. That is mean if you don't treat quick enough, the patient have a totally bad light scar that live forever. So right now we are now in developing the new treatment for that.
Right.
So of course I'm interested also a little bit shift to many diseases that have affected the hair people.
Now, I think the most important question that many people are wondering is how expensive is this process?
Actually, when compared to other laser treatment, it's almost the same. Because the laser treatment is, of course, is not quite very cheap because the machines have the cost and you have to have consumable costs for the treatment. It's not expensive, but it's not like quite cheap, but it's a reasonable price.
Now, if we believe that prevention is better than cure, how would you recommend our audience in preserving their hair, the health of their hair, their scalp, the skin on their head?
So very good questions, because when you see your mom and your dad, they usually start to have a thinning hair when they get older.
Right.
Some people that, my mom, my dad, they just only have a senile alopecia. When they get older, he or she starts to have a thinning hair. But when the patient comes, I'm still young, but I have started to problem of hair loss. It is because our lifestyle have been changed. Right? Because of not only for the genetic, not because of the hormone, the environmental factor also important for affecting the healthiest of the hair.
Right.
Importantly, it's a sleepy. You have to have a good sleep. You have to have a good nutrition, because people like now, they don't have a good nutrition sometimes, because we have a rush environment, everyone that rushing, so the food is sometimes not enough.
Right.
The proteins, the everything intake, and of course, importantly, is about the stress. Everyone get more stressful life even right now.
Yeah.
So it has been changed from the life in the past. So that's why we see a lot of patients with the younger age come with the hair problems.
Right.
So I recommend, of course, doing the good lifestyle, good eating, sleep well, and less stress.
Right.
And when you get the abnormal hair sheddings or have a hair problem, better to come earlier to see the doctor.
Right. So it's pretty much the holistic, positive lifestyle.
Yes, of course, because our hair is reflect your life, your physical healthiness. If you have a sickness, even in both physical and psychological, like you stress, you depressed, of course, your hair will be falling.
And now that I'm here at the Hair and Scalp Clinic of Chulalongkorn Memorial Hospital, I might as well kindly ask Dr. Ratchathorn for a quick evaluation. And yes, she detects quite a portion of thin strands of hair on my head. Maybe I'll need to come back another day for a full treatment session. And if any of you seek professional consultation or treatment regarding hair thinning and hair loss problems, please feel free to contact Dr. Ratchathorn and her colleagues at the Hair and Scalp Clinic, Division of Dermatology, Pawpaw Building, 14th floor, Chulalongkorn Memorial Hospital, Thai Red Cross Society. And that's it for this episode of Chula Innovations Unlocked with me, Suphajon Klinsuwan. See you next time. Sawasdee krap. Well, thank you so much for your time, and once again, congratulations on your success.
Thank you.
ขอบคุณมากครับ
สวัสดีค่ะ
Chula Innovations Unlocked is produced and presented by Suphajon Klinsuwan. This program is brought to you by Chulalongkorn University.